This presentation covers the essential muscles you need to know for the exam based on the provided summary. We will look at the muscles of mastication and facial expression, focusing on their origins, insertions, actions, and nerve supplies. The masseter muscle originates from the zygomatic arch and inserts on the lateral surface of the ramus of the mandible. Its actions include the elevation and protrusion of the mandible, as well as lateral deviation to the same side ipsilateral. It is innervated by the cranial nerve V, also known as the trigeminal nerve. The temporalis muscle originates from the lateral surface of the temporal bone and inserts on the coronoid process. It is responsible for the elevation and retrusion of the mandible and lateral deviation to the same side ipsilateral. The muscle is also innervated by the cranial nerve V, the trigeminal nerve. The lateral pterygoid muscle stabilizes the TMJ, assists in protrusion, depression, and lateral deviation of the mandible to the opposite side contralateral. The medial pterygoid muscle aids in the elevation, protrusion, and lateral deviation of the mandible to the opposite side contralateral. The orbicularis oris muscle originates from the insertions of circumoral muscles and the incisive fossae of the maxilla and mandible, inserting in the skin of the lips. It compresses the lips against the teeth, closes the oral fissure, and protrudes the lips. The buccinator muscle originates from the buccal alveolar process of the maxilla and mandible, aiding in mastication by compressing the cheeks against the teeth. Both muscles are innervated by the facial nerve 7. The orbicularis oculi muscle has an orbital part that originates from the medial orbital margin and inserts via the medial palpebral ligament, aiding in the forcible closure of the eyelids. The lacrimal part originates from the lacrimal bone and aids in squeezing the lacrimal bulb. Both parts are innervated by the facial nerve 7. Understanding the anatomy of facial muscles is crucial for both medical professionals and students. We will explore the main facial muscles, their origins, insertions, actions, and nerve supplies, using detailed diagrams to aid comprehension. The occipitalis muscle is involved in scalp movement and facial expressions, particularly in elevating the eyebrows and pulling the scalp forward. It is innervated by the facial nerve 7. The frontalis muscle is responsible for raising the eyebrows and wrinkling the forehead. It plays a key role in facial expressions of surprise or curiosity. The platysma is a broad sheet of muscle fibers extending from the collarbone to the angle of the jaw. It is involved in depressing the lower jaw and lip, contributing to expressions of sadness or fright. The nasalis muscle plays a role in nose movements, particularly in flaring the nostrils. The procerus muscle is essential for creating expressions of anger or concentration by pulling down the skin between the eyebrows. Here, we will explore various facial muscles, their positions and functions. Understanding these muscles is crucial for fields like anatomy, medicine, and physiotherapy. The levator palpebrae superioris is responsible for lifting the upper eyelid. This muscle plays a crucial role in the opening of the eye. The corrugatus supercilii muscle helps in frowning by drawing the eyebrows downward and inward. It is essential for expressions of concern or concentration. The depressor anguli oris and depressor labii inferioris are involved in lowering the corners of the mouth and the lower lip, respectively. They are key muscles for sad and pouty facial expressions. The levator anguli oris and levator labii superioris are responsible for lifting the upper lip and the corners of the mouth, aiding in expressions like smiling and showing the upper teeth. The levator labii superioris alique nasi assists in flaring the nostrils and elevating the upper lip. The mentalis muscle is responsible for elevating and protruding the lower lip, creating expressions of doubt or displeasure. The risorius muscle is a small muscle of facial expression. It is positioned horizontally and runs from the angle of the mouth to the back of the jaw. It is primarily responsible for stretching the lips. The zygomaticus major muscle is a major muscle of facial expression. It extends from the zygomatic bone to the angle of the mouth. When it contracts, it elevates the upper lips, enabling a smile. The zygomaticus minor muscle is a thin muscle that also aids in facial expression. It assists the zygomaticus major in elevating the upper lip to produce a smile. The muscles in the submandibular region include the suprahyoid group, which is responsible for the depression of the mandible and opening the mouth. This group includes the mylohyoid, geniohyoid, stylohyoid, and digastric muscles. The infrahyoid muscles are a group of 4 muscles positioned below the hyoid bone. These muscles include the sternohyoid, sternothyroid, thyrohyoid, and omohyoid. They play a crucial role in swallowing and movement through the larynx. The sternocleidomastoid is a significant muscle in the anterior triangle of the neck. It originates from the sternum and clavicle and inserts into the mastoid process of the temporal bone. Its actions include rotating the head, flexing the neck, and extending the head. It is innervated by the spinal accessory nerve CN11 and cervical nerves C2 and C3. The trapezius muscle is key in the posterior triangle of the neck. It has distinct upper, middle, and lower fibers that originate from various points, including the occipital bone and thoracic vertebrae, and insert into the clavicle and scapula. Its actions range from elevating and retracting the scapula to rotation. It is innervated by the accessory nerve CN11, as well as cervical nerves C3 and C4. The scalene muscles are divided into anterior, middle, and posterior scalene. They originate from the transverse processes of cervical vertebrae C2-7 and insert into the first and second ribs. These muscles play a crucial role in elevating the first and second ribs during deep inspiration, lateral flexion, and rotation of the neck. They are innervated by the anterior rami of spinal nerves C3-8. The serratus anterior muscle originates from the lateral surface of the upper 8 ribs and inserts into the anterior surface of the vertebral border of the scapula. Its actions include abduction, protraction, upward rotation, stabilization of the scapula against the chest wall, depression of the scapula, and assistance in forced exhalation. This muscle is innervated by the long thoracic nerve, C5, C6, C7. The longus colli and longus capitis muscles are located in the neck. These muscles are important for neck flexion and stabilization. They are part of the deep cervical flexor group and play a role in maintaining proper head posture. It is important to identify these muscles for their anatomical significance, but not necessary to memorize their detailed OIN, origin, insertion, action, nerve, for this context. The latissimus dorsi muscle is a large, flat muscle on the back that extends from the lower thoracic spine to the humerus. It is responsible for actions such as extension, medial rotation, adduction of the humerus, and assists in the depression and medial rotation of the scapula. Its origin includes the thoracolumbar aponeurosis, lower 6 thoracic vertebrae, iliac crest, lower 3 to 4 ribs, and the inferior angle of the scapula. The latissimus dorsi inserts into the bicipital groove of the humerus and is innervated by the thoracodorsal nerve, C6, C7, C8. The levator scapulae muscle originates from the C1, C4 transverse processes and inserts at the vertebral borders of the scapula from the superior angle to the root of the spine. Its actions include elevation and medial, downward, rotation of the scapula, and it is innervated by the dorsal scapular nerve, C5. The rhomboid minor muscle originates from the C7 and T1 spinous processes and inserts at the root of the spine of the scapula. Its actions include adduction, retraction, and medial, downward, rotation of the scapula. It is innervated by the dorsal scapular nerve, C4-5. The rhomboid major muscle originates from the T2, T5 spinous processes and inserts at the vertebral border of the scapula from the root of the spine to the inferior angle. Its actions include adduction, retraction, and medial, downward, rotation of the scapula. It is innervated by the dorsal scapular nerve, C4-5. The serratus posterior superior muscle is responsible for elevating the ribs, which increases the thoracic cavity during inspiration. The serratus posterior inferior muscle functions by depressing the ribs outward, counteracting the inward pull of the diaphragm during expiration. The splenius capitis muscle has several functions. Bilaterally, it extends the head and neck. Unilaterally, it contributes to lateral flexion of the head and neck and rotation of the head and neck to the same side. In this section, we will explore various muscles of the back, their functions, and their anatomical significance. The splenius cervicis muscle is located in the neck and upper back. It is responsible for extending and rotating the head and neck. When both sides of the muscle contract, they extend the head and neck. When only one side contracts, it causes lateral flexion and rotation to the same side. The iliocostalis is part of the erector spinae group, running along the spine. It helps in extending and laterally flexing the spine. This muscle plays a crucial role in maintaining posture and ensuring the flexibility of the spinal column. The longissimus muscle is another component of the erector spinae group. It extends the length of the back and is pivotal in extending and laterally flexing the spine. This muscle ensures the spine's movement and stability. The spinalis muscle is the most medial muscle of the erector spinae group. It primarily functions to extend the spine and assist in lateral flexion. The spinalis helps in maintaining an upright posture. The semispinalis muscle is part of the transversa spinalis group. It spans several vertebrae and is responsible for extending and rotating the spine. This muscle contributes significantly to the fine movements and stabilization of the spine. The multifidus muscle lies deep in the spine, spanning across the vertebrae. It is crucial for stabilizing the vertebral column during movement. The multifidus works continuously to maintain posture and support the spine's intricate movements. The rotator's muscles are small, deep muscles located in the thoracic region of the spine. Bilaterally, they assist in the extension of the spine, while unilaterally, they help in rotating the spine to the opposite side. The image shows the rotator's muscles highlighted in green, running between the transverse and spinous processes of the vertebrae. These muscles play a crucial role in stabilizing the spine and assisting in its movement.